across. So I'm going to tap, make tenderness. You can do an indirect tap like that, or you can do a direct tap, make tenderness. Okay, and I have to turn back around. And we're going to continue with our skin assessment. We're looking for skin is uncovered at this point, looking for lumps, bumps, and lesions. I'm going to feel her chest, her tenderness, her lumps, any problems with that. Still assessing her work of breathing, still looking for intercostal muscle use and that kind of thing. So I need to check for chest expansion. Put my hands to the bottom of the ribs, deep breath. Good, equal chest expansion. And so now we need to do percussion. We're going to start above the clavicle in 3 spaces. The 3 spaces anteriorly, they're much closer together than posteriorly. And then you percuss below the level of the clavicles at approximately the 2nd intercostal space. So it's going to be right sternal border, left sternal border, all the way down and then underneath the breast. If you have someone who has larger breast tissue, you can gently deep displace the breast or ask the person to do that. Up here. And we're done with that. So now we will go ahead and do the inspection of the heart. I'm looking at her anterior chest, and I'm looking for heaves or lifts. I'm going to feel her anterior chest for thrills. You need to go down a little bit further as well, feeling for thrills. And then I'm going to listen to her heart sounds. So this is, again, you need to listen with the diaphragm and the bell. This has it all in one. But even if it doesn't have it all in one, I just do it 2 times because that's how I was trained. And it's just easier. So again, start at the 2nd intercostal space, right sternal border. And you do want to be listening for a few beats because you are assessing the heart sounds and you're listening for murmurs. So if you just place your stethoscope in that spot, you're not truly assessing. So a couple of beats. And actually I need this in my ear so I can hear the beats. Sorry. Usually I fake it in here. I always stop at Erb's point because that's the way I was taught. You don't necessarily have to. And again, that was diaphragm, conservative bell, doing the same things. I need to locate the point of maximal impulse, and I would do this skin to skin, typically. Yeah, it's right there. Nice. Nice and easy to locate. Then I'm going to listen to the point of maximal impulse or apical pulse. Compare it to a radial pulse. It should be on the same rhythm. Every heartbeat you hear, you should be able to feel. And if you feel discrepancy, you would do it in the other arm just for verification. Okay. And this is when you're supposed to do peripheral vascular, looking at her color all over her body. And we already did warmth, tenderness, and temperature, warmth, tenderness, and texture here. And we'll continue to do that throughout all of the skin. And she's got purple toes. Check for have refill. Are you able to feel me touch your toes? We're going to check for edema. When you're checking for edema, people can have edema in their feet, in their ankle, pre-tibial. They could have it all the way up their legs. So making sure that we're feeling all the way up is good practice. This is where we should check for clubbing, looking for the angle of the nails. Hold your nails like this. Pretty critical. Do you mind laying down for an abdominal assessment? And I didn't do my pulses yet. I tend to do those when I do my femoral pulse and inguinal node. You can do it whenever you feel like doing it. So first, I'm looking at her abdomen. This arm's right side. And I'm looking for the shape, the contour. I have a tangential light here looking for shadowing and pulsations. Okay, getting a good idea of what her abdomen is like. And then I need to listen to her vowel sounds. And I start in the right lower quadrant. Vowel sounds. She just happens to have active sounds in her belly right now. If your patient does not have active sounds in their belly, normally in real life, you would just wait for the sound because you have to know if they're there. For our practice, wait a couple seconds, and if you don't hear them, continue to listen in all of the quadrants. You can do it in 4 quadrants like I just did, which is my general practice, or you can do it in 6 quadrants. Some books have it like that, and that's fine to do. Okay, and so now we've already listened to bowel sounds, so we can percuss her abdomen. She has nice tympanic sounds. I'm percussing over this edge of the costals because I want to see if the spleen is engorged and lower. And it's not. You would have pure duller sound. The same thing over the liver on the other side. And so now we're going to go ahead and do palpation. Start with light palpation. You want to make sure you're palpating all the regions of the abdomen. You want to be looking at her face. If she's very ticklish, sometimes touching the shoulder first and then touching them will somehow displaces like the way the nerves react. So we can do that for patients like that. Now we need to do deep palpation. And we're feeling lumps and masses. And that's pretty much your abdominal assessment except for nodes. So I'm going to check for inguinal nodes, which are going to be, they're right here, and they run down the leg and down the center of the leg, but assessing right here is fine. And then I'll check for femoral artery. Femoral artery is a nice central pulse, so it should be as strong as your carotid pulse. That was good and strong bilaterally. Every pulse I'll check bilaterally except for carotid pulse. Radial pulse. Radial pulse. Posterior tibial pulse. Checking pulses with fingertips, not thumbs. Pulses. And where are we at?
Do we have to do popliteal?
Don't have to do popliteal, no. Okay, this begins your musculoskeletal assessment, so I'm going to check for leg drift. So with one leg, raise your leg up off the table. Go one leg down, the other leg. You can set that down. And it's approximately 5 seconds. You know, in the video, he actually counted. You don't have to do all that, that'll be fine. Can you go ahead and sit up for me? And put your legs around to the side. And for the musculoskeletal assessment, I'm basically palpating every joint. I've already done her TMJ, so I'm going to palpate her spine for warmth and tenderness. I could have done her spine when I had her posterior for her chest exam. It's fine. Palpating shoulders for warmth and tenderness. And take the joints through the range of motion to feel if there's any movement. For every joint, we're going to do the same thing. We're going to notice the hands have a lot of joints. Look at all of them. Tenderness. We'll do the hips when we stand up, and this is the knee. And we'll get the ankles and toes. Soft touch and sharp versus dull on your extremities. Can you close your eyes for me? Tell me if you feel me touch you with this.
Yes.
Your book has you doing 3 spots on the arm, 3 spots on the legs. That's fine to do. I'm not sure if I did 3. I didn't actually count. I should have paid attention to myself. And again, this is dull and this is sharp. And tell me what you feel.
Dull. Sharp. Dull. Sharp. Dull. 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 Sharp. Dull. Sharp. Sharp. Dull. Dull.
You just have to do nice deliberate actions so she doesn't be looking at it. While she's sitting here, I'm going to go ahead and test her reflexes. So you're going to be doing biceps reflex.
Sorry.
You're going to do it 2 times, reposition. I'm still not getting it. Have her clench your jaws. If you don't get it, then you document unable to elicit. And that one we were able to get. We're going to do patellar. Again, if you were unable to elicit, you would do it 2 times, reinforce, try a 3rd time, and move on to the next thing. While you're sitting, we're going to do a couple of things, because after that, then I will be able to keep you standing for the rest of it. Can you take the heel of this foot up against the shin and run it down and then back up? Good. And can you do it on the other side? Very good. And can you squeeze my fingers as strong as you can? Good. Nice and equal. In your examination, you will choose an index card with a joint, an upper joint and a lower joint. And you will take that joint through its full range of motion. And we'll do musculoskeletal next week, so you'll know exactly what that entails. However, you do know it from Nursing 270. But for instance, if you were examining this joint in the range of motion, you need to supply support for the joint or have the patient do what you do. So can you bend your elbow? Can you extend your elbow? Can you supinate your forearm? Can you curve your forearms? Invert your wrist, evert your wrist. What's this? Flexion, extension, hyperextension, etc. Okay? And now we'll do a finger nose test. So I'm going to have you touch your nose and touch my finger. And you want to do it slow enough so a patient who did have neuro deficits would be able to do that, because it's pretty fun with your friends to do it, right? Okay, and so now we have Romberg and Gait Assessment Lab. So I'll have you stand up. And first I'm going to check your balance. So can you close your eyes? And I'm going to check your gait. So if you can walk over here to the lady in the blue shirt, which I should know your name, but I can't remember it. I'm looking at her gait. Does she have any limps or foot drop? And that's a normal assessment. So we're actually finished with your assessment. Do you have any questions? Okay. All right. So start recording.